Good morning everyone. Welcome to this demo session on medical coding. My name is Krishna and I am a medical coder with real-time industry experience. In this demo class, I will explain what is medical coding, what is revenue cycle management, role of a medical coder, what is HCC, why it is an important career, salaries in medical coding, eligibility criteria, key medical coding books in medical coding, what is Medicare and Medicaid certifications in medical coding, and I will give you a small ICD-10-CM coding example. This session is especially useful for freshers and non-medical background students also. So, what is medical coding? So, medical coding is the process of converting a patient's medical diagnosis into standardized codes. Okay, medical coding is the transformation of healthcare diagnosis, procedures, services and supplies into universal alphanumerical codes. Example, diabetes is the one of the condition. Okay, what is that code? E119. This is a ICD-10-CM code. So asthma code is J45909. So whenever a patient visits a hospital or clinic, the doctor documents diagnosis, procedures, treatments provided. These details are written in medical language, but insurance companies cannot understand medical notes directly. So, medical coders translate the medical reports into universal codes, such as, for example, diabetes mellitus ICD code is E119. So, I will explain how to identify and assign ICD codes in detail in upcoming sessions. So first we need to know about the ICD-10-CM. So ICD-10-CM is a book. So International Classification of Diseases. So ICD means International Classification of Diseases. 10 means 10th revision. Okay, 10th revision. CM means clinical modification. So ICD-10-CM mainly used in US healthcare system to assign codes to diseases. Okay, so published by World Health Organization. So okay, published by WHO. So NCHS and CMS, DHHS, these three organizations provide the guidelines. Okay, these three organizations provide the guidelines. So what is NCHS? National Center for Health Statistics. Okay, National Center for Health Statistics. CMS means Center for Medicare and Medicaid Services. Okay, so these three organizations provide the guidelines, and CMS, NCHS, AHA, AHIMA approved the guidelines. Okay, so these four organizations approved the guidelines. Every year October 1st updates the ICD-10-CM. Okay, Next, revenue cycle management, RCM. Now I will explain revenue cycle management, commonly called as RCM. I will make sure all steps are covered clearly from the time a patient schedule an appointment until the hospital receives payment. So RCM. Before understanding RCM, let us first see how hospital work in India and in the United States. Okay. So the patient experiences a health problem, okay, and decides to visit a hospital. In India, completely cash based, okay, cash based system. So how it works in India? So in India, most hospitals follow a cash based or direct payment system. For example, a patient visits a hospital, the doctor examines the patient, treatment is given, the patient pays the bill directly in a cash or online payment. Okay. In many cases, payment happens before discharge. No insurance claim is involved. Okay. The process is simple and short. So in India, the hospital collects money directly from the patient. But in USA insurance based example, most people in the United States still have health insurance because healthcare costs are extremely high. Okay, even a small medical issue can cost thousands of dollars without insurance. Hospital visits, doctor consultations, lab tests, surgeries, and emergency care are very expensive. Without insurance, patient must pay the full amount out of pocket. Okay, medical bills can create serious financial stress. With insurance, a large portion of the costs is covered by the insurance company. The patient. So, how it works in USA? The patient visit the hospital, treatment is provided. The patient does not pay the full payment immediately instead. So the hospital sends the bills to the insurance company. Insurance receives the services. Payment is sent to the hospital later. So because insurance is involved, the process becomes long and systematic. This entire financial process is called as revenue cycle management. Okay. So step 1, patient appointment scheduling. Second one, patient registration. So patient contacts hospital, book appointment. Okay. So person insurance entered in system. So insurance verification, third step. So fourth step is patient visits and treatment. Doctor examines and identify the problem and provide the treatment. So doctor documentation, fifth step. So documents symptoms and diagnosis procedures, everything he treated. So medical transcriptionist. So medical transcriptionist. So doctor's notes and recordings converted to clear EHR, electronic health record, or PDF format. Okay. So next step, medical coding. So our role is medical coding. Okay. Review records and assign ICD-10-CM codes for diagnosis. Okay. So next eighth step is charge entry. Okay. Then after claim creation, claim submission, claim review, payment posting, denial management, patient billing, patient payment, and exit the hospital. Okay. So next HCC. So HCC stands for Hierarchical Condition Category. So is a risk adjustment model designed to estimate future healthcare costs for patient along with demographic factors such as age, gender, and chronic conditions. Okay, so HCC is a system used in US healthcare insurance process to understand how sick a patient is and how much care they may need, instead paying the same amount for every patient. HCC helps insurance companies pay more for patients with serious or long-term conditions. So simple way to understand, if a patient has chronic illness like a diabetes, heart disease, or kidney problems, so they need more doctor visits, more tests, more treatments. So the insurance company need to spend more money on the patient. HCC helps capture these conditions properly, so payments are fair and accurate. So smart example, so patient, for example, one patient A and second patient is B. So patient A only mildly health issues, so patient B diabetes and heart diseases. So patient B needs more care, so insurance payment will be higher. For example, I will explain in Excel. So DM is one of the condition. Whenever you are entered in the tool, then automatically creates one HCC, that is default. So 21. So these 21 HCC decides RAF, risk adjustment factor. This factor decides the payment. Okay. So then automatically predicts the future healthcare costs. Okay. So next, Medicare and Medicaid. Okay. In the United States, Medicare and Medicaid are two major health insurance programs. So what is Medicare and what is Medicaid? So these are two plans divided mainly two plans. Okay. So Medicare is used for 65 age people and above people. Okay. So and ESRD chronic conditions, ESRD patients and chronic disabled patients, this plan is very useful. Okay. So Medicaid used for low income families in USA and pregnancy women and children, and Medicare is divided 4 parts: part A, part B, part C and part D. Medicare has 4 main parts. To understand easily, remember this simple logic. So part A, inpatient services, when a patient is admitted to the hospital and stays at least one night, means 24 hours above. Medicare Part A applies. Okay, so it covers hospital stay, bed charges, nursing care, and service provided during admission. So Part B means outpatient services. It is used for outpatient services. So when a patient visits a doctor or hospital and goes home the same day within 24 hours, Medicare Part B applies. So it covers doctor consultations, lab tests, scans, and outpatient procedures. So and Part C, both IP and OP. So Part C plan used for IP setting and OP setting. So this is a advanced plan in Medicare. So Medicare Part C is called Medicare Advantage. It combines Part A and Part B. So it covers both inpatient and outpatient services. These plans are provided by IP and OP settings. So Part D is used for drug prescription. Medicare Part D covers prescription medicines. Patients use this plan to get coverage for drugs prescribed by the doctor. Okay. Thank you for watching. If you are interested in training, feel free to contact me 905 220 1814. Thank you for watching.